Hello and welcome back to Medical Compliance with Clarissa. I'm Clarissa Benfield, our Global Director and Business Line Leader for our Medical and Laboratory business at Intertek. And today I'm so thrilled to be joined by my colleague, Alexander Crosby. Hi, Alex. How are you?
I'm well, Clarissa. Thanks for asking.
Yes, so excited to have you today. So as I always like to do when we kick off, maybe you can just share a little bit about yourself and where you sit in the business and how you are helping medical device manufacturers.
Absolutely. So I am the America's Medical Program Director for our Business Assurance business. Obviously you and I have sort of complementary views. You're looking at the testing part. I'm looking at the auditing part. Often we bump into one another virtually or in person at our clients. I've been working for Intertek for nearly 15 years, I think. So I've been around a bit, came from the medical device field sort of through consulting and then into the third-party assessment here at Intertek.
Yeah, wonderful. And we've had quite a few colleagues from Business Assurance join us on this podcast. Lots of interesting questions that have come out on all sorts of topics related to UKCA, MDR, all sorts of different types of things that fall under the system certification group. But today, really wanted to chat with you about some new changes that we were seeing. As you said, we see each other quite a bit out and about at industry events, the last one being the AAMI Nexus conference back in January. And of course, during that time, one of the big things that was being talked about, right, was the new QMS regulation rule, right, and the changes and all of this talk around the Part 820 and 13485. So maybe just from a high level, you can explain to everybody, what this change was that went into place back in January and what that means for a medical device manufacturer.
So it is interesting, sort of the evolution, right? So that the prior to this 21 CFR 820, which we used to be referred to, or I guess still referred to as a QSR, Quality System Regulation, was really adapted version of sort of 1345 1996. So they essentially came out in the same year. There were differences between the two, but the sort of our friends at the FDA basically felt that the quality system requirements should be published as regulation, as its own thing, that there was no reference per se to international standards. And that's sort of the baseline that we've been living with to today. And just as sort of comparison, so we had 1345 1996, 1345 2003, and now we're 1345 2016, right? So time has gone by. And I think both because of the global recognition that 1345 is the state of the art for medical device quality management systems, their experience with MDSAP and other things that we could get into in more detail, the FDA felt that they should update 21 CFR requirements and felt really that the most logical thing, as opposed to rewriting the specific requirements, was essentially to say, hey, we'll adopt 1345 2016 that essentially, while there are differences, that in a whole we feel it is as good and likely better than what we have, right? And of course, acknowledging that I won't say that they're slow to the table, because they've been working on this for a while, but it's not like other people haven't. This is not a revolutionary move, right? They're not adopting something that is anyway controversial.
Yeah, so you touched on it a little bit there. So really what we think, obviously we don't speak on behalf of the FDA, but we hear from them, right, what their intentions are, right, and why they do something like that. So really is this, as we're seeing 1345 be so globally adopted, right, and such a harmonized state-of-the-art usage, right? That's
Yes.
really, the motivation behind the FDA wanting to do this.
I mean, it's really the lingua franca, again, that they already, as the framework, the underlying framework for MDSAP is 1345. So to a certain extent, they've already kind of recognized it through I wouldn't say backdoor, but it's already in practice there. And some of the specific things which are different from 1345, that functionally, I think that they feel that those differences aren't meaningful enough for them to kind of continue to ask for those specific bits and pieces. And the idea that they are, I think, calling this the quality management system regulation, they're trying to make a distinction between there, is sort of that idea, I guess, like as things progress, that we progress from, quality control to quality department to quality management system. So they're thinking that, we're moving in the right direction. And they really, one of the things that they have said a number of times is they'd like to move beyond compliance, right? They would really like to see like people use the quality management system to improve things, and not just like, hey, here's a letter of the law and we do that. That's important. But that we have all these built-in tools into 1345, which allow us to theoretically respond, make things better, move in the right direction, meet quality objectives, change quality objectives. So they're really interested in that kind of idea. It is always interesting to hear the FDA speak. They're as interested in innovation as they are in compliance. I mean, again, they obviously, safety and effectiveness is their core business, but they are actively interested in, being the sort of leaders of sort of from a regulatory perspective of innovative medical technology. And I think the U.S. is 40% of the medical device market. It's the biggest chunk, right? So a lot of this plays into that. It's not just this kind of, state organization that just wants everybody to fill out pieces of paper. They want us to kind of move ahead.
Yeah, and I love hearing you say that. We've talked a lot about this in, different capacities and different discussions on this podcast with the FDA, right? Just in terms of, really how they've moved forward to work more with industry. I love hearing you say, right, it isn't just about compliance, right? It is about compliance and then some, right? State of the art, what you can do to continuously improve, especially as we see our industry moving forward so quickly, right? Medical device development is so advanced. What people are doing is so advanced. And really this idea that the FDA is partnering with industry, working together, right? Moving innovation forward. It's incredible to look at, right? Just this kind of evolution. And when we see, so many manufacturers wanting to come to the US market and work with the FDA, this is just another way to, again, streamline. And now we see, as the leader of the IMDRF, like we're going to see even more of this, right? Now that it's being chaired out of the US, more of this sort of collaboration, harmonization, as well as the innovation part.
Right. And I think that, we talk a lot about harmonization and regulatory convergence. And kind of the analogy that I use is like in the 90s, we talked about system integration kind of at the desktop, which is that you might be able to present all the data in sort of one fashion, like a web browser, but all those systems were different in the background. And that's still, in many cases, true of regulation at the moment. Like there is overlap, but again, each regulator kind of wants what they want. That when they adopt 1345, in my mind, that's real convergence. It's like essentially we are all accepting this one thing. It's not like a complaint is in our definition X and Y, and over here it's X and Z. But here we again have this idea of, we have a lot on our plate. The cost, whether it be the pure public cost of these agencies, or the cost of having bad devices out there, or not having cutting out devices is high. And anywhere that we feel that there are efficiencies that can be had, let's do that. And again, I think this is a big step in that right step in that direction.
Yeah, absolutely. So, from your perspective too, right, with what you've seen, again, when we hear the FDA speak on these topics or speak with manufacturers, were there things that the FDA has been doing, is continuing to do to prepare the industry, right? You talk a little bit about MDSAP, previously kind
Yeah.
of aligning with 1345. So from that side.
I think, well, again, the FDA does, I think, an excellent job of outreach. They talk a lot to the public. That their website, of course, it has a plethora of information. And one of the things that we kept hearing over and over at the Amy Nexus thing was like, well, if you have questions, come talk to us. Like there's a limit. Here are some generalities, but you have a device, you have these things. Make an appointment, come talk to us. So I think with 1345, I think that there's sort of the bigger change really for the FDA. And again, this is me, as you say, you can't speak for the FDA, so this is somewhat suppositional, but most of the marketplace is familiar with 1345. This is not going to be a shock. Whether or not they are 1345 is something else, right? I think the bigger change is really in the agency, because they've been living, with this for 28 years or something like that. Is that right? So it's, and again, it's obviously that the elements of the FDA are familiar with 1345, but the idea of having to kind of manage this change through all the regional offices and the inspectors and all that kind of thing. So obviously, our clients in the field that have not adopted this will have to go through some change management process. But in some senses, I think that pales to the work that the FDA has to do to basically, create whatever programs or modify whatever programs they need to do this. Yeah.
Yeah, so you mentioned them briefly, but let's talk a little bit about the inspectors and the inspection process, right? Like, does that change? Is that impactful?
Yeah. I mean, we don't know yet. I mean, we know that they are going to change. I mean, whatever, is it going to be, QSIT version 2? We don't know what the title of it will be, but we definitely know that it will change, that they will have to come up with a new inspection model. Again, it will be interesting to see how much of this is informed by MDSAP. So they have, an audit model. Will that, so QSIT obviously informed somewhat the MDSAP model. Will the MDSAP model inform whatever the new inspection routine is an open question mark. I can't believe that it won't at some level, because again, there's a lot of familiarity, right? So yeah.
So something for manufacturers to stay tuned on, right, to see what they're directed to do. Yeah.
Yeah. I mean, I think it will be very interesting, and we're going to the MDSAP forum, which is the AOs and the regulators, is in Germany this year in June. So hopefully I can also extract some information about what they think they're doing, how any of these things bond, because obviously there are the changes that our clients who are not MDSAP or 1345 need to do. But obviously we, as an auditing organization under MDSAP, will have to have a new audit model, because there are all these little, FDA things that will have to be revised and hopefully eliminated, right? So again, if we're looking at labeling, we're not looking at slightly different versions of the same thing. So.
Yes, of course. The only constant in the medical industry is change, right? I mean, that's always, keep informed, keep aware, right? And of new changes coming down. So when we think about changes, right, you talked about the different versions of 1345, right, that we've had, with the latest being that 2016 version. So obviously pretty outdated at this point right now that we're in 2024. That's, quite an old standard that was published. So what is the thought process behind, what if the standard 1345 gets updated to a 2025 version, right? What is that going to look like in terms of the harmonization?
And I think, so I have kind of multiple answers to that. Like, I guess the first answer is that the regulators are likely always going to kind of be bringing up the rear. Just as an example, I think it was like 2 years after ISO 1345 2003 expired as a standard, that the Japanese, the PMDA, recognized 2016, right? So there have been examples where there's a gap there, right?
Yeah.
And we can manage that gap because obviously if you're recognizing an older version of the standard and you say, so, you know, if while the standard may expire and we say can't do ISO 13485 2016 certificates under SCC or ANAB, but it is still recognized under something else. So it gets kind of as a baseline, that's kind of one answer. The second answer is that we already went through this once with MDSAP. MDSAP came out originally with 2003, and then we went to 2016, right? So we've done that leap. I think the third thing is that the regulators have very loud voice in whatever is it, TCT 10. I'll get the number wrong, but whatever the ISO committee is, and so the likelihood of the standard moving quickly to something that the regulators don't agree with seems unlikely.
Yeah.
Because what is the point of having a quality management system to meet regulatory requirements that the regulators, especially the largest regulator in the world, doesn't like, right? You've succeeded and failed at the same time.
Yeah, exactly. Yeah, that's so true.
I do think, though, there is an interesting thing to be said, because, you know, again, it's kind of nerdy, but so obviously 1345 used to be based off of 9001, and then it didn't adopt the 2015 9001 2015. Like there was kind of a schism there, so it's kind of its own thing, and it hasn't adopted the new the means of organizing the standard. So I do think that regardless of sort of the FDA, there are other kind of large questions about what that is going to look like. Will it continue to be sort of this standard that kind of trails the other standards because everybody's familiar with it? Or does it need to take a big leap? I don't know, maybe subject for another conversation. But there are elements like one of the things, right, was is like preventive action, just as a, you know, kind of a small aside, which is all of these standards have corrective actions and preventive actions. And in 9001, 2015, they determined that preventive actions were no longer necessary because the quality management system as a whole is essentially a preventive action or a collection of preventive actions. They're meant to be fixing stuff, right? You know, like, but so there's a divergence because preventive action is still in 1345, 2016, where I think we made kind of the right decision from a quality management perspective, but it wasn't really something potentially the regulators were interested in. So there is sometimes tension between how standards need to move. You know, that 9000 2015, I think, talks about data or information, where 1345 talks about records. So, you know, there is an inherent tension there that will need to play out across the course of time.
Yeah, it'll be interesting to see as we go forward. So before we wrap up today, I think one thing that, of course, everyone always wants to know and understand is effectiveness, right? When do we have to meet these requirements? When are we absolutely our drop dead requirement date? So is there a timeline of when it goes into effect or when someone has to be?
I think it, and here I'll be deliberately a little vague. I know that it comes into force in February 2026, right? So you have a beat to get your act together. We do know in the past that some, and again, here you're asking something beyond my knowledge, but like UDI, for instance, as an example, was a phased approach and was based on risk categorization. So does that exist at the moment? I'm not 100% sure. Is it possible that later down they'll say, oh, we'll delay it for this type of things because of, you know, feedback? That's also a possibility. But, you know, in general, if you're 21 CFR compliant now, it's not a huge leap. I think that, you know, when we went from the 2003 to 2016 kind of upgrade, that's really the things like in there, the risk-based approach, validation of software, device master file production, and realization moving into shipping and handling. So, you know, all of these things which are not huge in themselves and are quite dealable with, but still, as a whole, will require you to think through these things. But again, it's evolutionary. It's not revolutionary. Yeah.
Yeah, and as we know, right, 2026 will be here before we know it. So it's
Yes.
good to kind of start getting your ducks in a row and moving towards
Yes.
it, right?
Yeah.
Using
Start
what you've
thinking
done
about
and-
it.
Yeah.
I mean, and again, that whole thing, like, are we gonna self-comply or claim compliance? Should we do 1345 certification, which obviously we'd be happy to talk to you about that. If we're doing 1345 certification, does EVISAP, is that a good, should we take the next step and do that? And of course, there are answers to all of those questions, how large of an organization you are, what classification of products you have, what, are you just domestic or do you have other things? But yeah, it's definitely worth thinking, starting a gap analysis and kind of thinking about, what your organization's strategy is around this. Yeah.
Yeah, exploring that regulatory road mapping as you're working through it. Well, of course, if anyone has questions, they can reach out directly and we'll connect them with you. Alex, thank you so much for joining today. It was a pleasure to talk to you. And again, thanks everybody for joining.
Thanks, Clarissa.